Period pain is normal. Just tough it out. Intense, debilitating pain is not normal and deserves some attention. Endometriosis is a condition a lot of people suffer with, but often goes undiagnosed. Let's break down what it is, how to recognize it, and why it's so important to talk about. So, what is endometriosis? Endometriosis is a condition where tissues that are similar to the ones that line the inside of your uterus, which is called your endometrium, starts growing outside of the uterus. Now, this is a problem because it can cause inflammation, pain, even scar tissue. Common places that this affects are your ovaries, your fallopian tubes, the tissues that line outside your pelvis. Because it doesn't belong there, it causes irritation and pain. Who does it affect? Endometriosis can affect anyone with a uterus. If you have a uterus, you can have it. But it's most commonly diagnosed in women between the ages of 30 and 40. However, it can start much earlier than that, even in teenage years. So what are the symptoms to watch out for? Severe pain that cannot be relieved by painkillers, pain during or after sex, pain on bowel movement or urination, especially during your period, fertility issues, heavy or irregular periods. Why does endometriosis happen? Again, doctors aren't really sure why it happens, but there are some really strong theories that we're going to talk about. There's something called retrograde menstruation, which basically means when you're menstruating, instead of the blood to flow outside of your body, it flows back into your pelvis. And this can cause the problems that we talked about, where tissues are growing in different places where they shouldn't be growing. If it runs in the family, there's a high chance that you could get it as well. When there are foreign tissues growing where they shouldn't, the body normally recognizes this and fights it. But if the body cannot recognize it properly, then this could lead to endometriosis. So what are the complications and the impact on someone's life? It's not just about pain. Endometriosis can affect fertility, energy levels, and your overall quality of life. Sadly, around 30 to 50% of those with endometriosis may experience difficulty conceiving. Constant pain can be so exhausting and can have such a huge impact on daily life. So what are the treatment and management options? For best management, we're going to combine medical and lifestyle management to give you the best quality of life. NSAIDs like ibuprofen are really good to help you manage painful symptoms. If your pain is very severe, you might need to get stronger prescription. Like birth controls or IUDs, this can help you manage some of the other symptoms of endometriosis, such as the irregular periods. Now, for those with severe endometriosis, surgery might be an option for you because this will help you remove or destroy the endometrial tissue. Because this endometrial tissue causes inflammation because they grow in places that they shouldn't, eating anti-inflammatory meals may help. Heat therapy. Using a heat pad can relieve the pain quite a bit. Physical therapy can help to manage the pelvic pain that you could experience. So when do I need to see a doctor? If your pain is affecting your daily life, it's keeping you from work, from school, from doing the things that you love, then it's time to see your doctor. You deserve some answers and effective treatment. There are different ways endometriosis can be diagnosed, but you need to see a healthcare provider so that you can get a diagnosis. Have you ever heard of endometriosis or know someone living with this condition? Share your experience or questions in the comment section. I would love to hear from you.